Terry Brooks with Kentucky Youth Advocates. Our vision is that Kentucky is the best place in America to be young. And for that vision to become a reality, we have to look at the health of children. And we know that in the Commonwealth, you cannot talk about the health of children without assessing and analyzing the implementation of managed care. Managed care in the Commonwealth, an unqualified success or an unmitigated failure. It's too early to tell. The real challenge is whether the Cabinet is looking for and learning from the lessons that have already emerged. KYA's beat, which clearly is looking at families and children, are picking up very discordant notes in a number of areas. Probably the most troubling is a real threat to mental health services for the young people who are enrolled in managed care. We're hearing lots of different opinions offered, why those services are becoming more difficult, why those services are becoming diluted, why those services are becoming inaccessible. And we're digging to try to find not just what the problem is, but solutions. But it's those early trend lines that we hope that the Cabinet is looking at. We hope that the Cabinet is engaging both providers and members around, and we hope that the Cabinet is looking for immediate solutions, not procrastinating on that. They have to be much more intentional about communicating with members. That means that they have to be sensitive to issues of timing. It means they cannot send members letters that are great only if you've recently received your doctor's certification from Harvard. They have to be much more patient and member sensitive. We know right now that, as has been well documented, that there is a emerging crisis in payment for providers. Our concern about that really is that it goes to members, not just providers. If providers are not being paid in a responsive way, that is going to trickle down and impact services to members. When folks are talking about managed care, let's say in 3 to 5 years, what will the metric, what will the rubric be to evaluate whether this was a grand and noble idea or whether it was a disaster? We actually think the answer to that is pretty simple. Has healthcare improved in quality? Has healthcare increased in accessibility? Those are the two factors, access and quality. When it's all said and done, all of the other rhetoric, all of the political posturing doesn't mean anything. It does boil down to whether Kentuckians are receiving better quality and more accessible health care in 3 to 5 years than they were 3 to 5 years ago. One of the steps that Kentucky Youth Advocates has taken to make sure that an analysis of what's going on reflects grassroots voices is that we've established a hotline where we really are inviting especially members to communicate their experience, whether that's an experience of success or an experience of frustration. You can access that hotline on our website. That's kyouth.org. And obviously we believe that it's those member stories that can animate and inform the administration and legislators as they look at this first phase of implementation.